Hello, everyone, and welcome to our webinar titled Maximizing Impact, Evidence-Based Practices for Effective Interpreter Use. My name is Yusra Hamid.
And my name is Anna Van Dyke. We are DNP students at Michigan State University studying to become family nurse practitioners. Today, we'll explore evidence-based strategies and cover best practices for working with interpreters and fostering collaboration for better communication. Thank you for joining us today.
And we'd like to ask you guys to complete the pre and post survey that's provided to help facilitate our DNP project data collection. This is the QR code and a link that you can use either or to complete our short pre-survey. And if you don't mind to complete the pre-survey prior to continuing the webinar, and please remember the unique ID code that you will create at the start of the survey. Thank you so much. So now to proceed with our webinar, the three objectives that we have for today are to identify the difference between an interpreter and translator, understand the modes and rules of interpretation, and understand the steps of the interpreter use guide.
Today, we'll be talking about a little bit of an introduction to our webinar and ourselves. We'll be going over some definitions that are important to remember for this webinar. We'll be talking about modes of interpretation, the roles of the interpreter, a specific evidence-based guide that is used for effective interpreter use, and then we'll be ending with some final tips and takeaways. So I would like to ask everyone a question prior to starting this webinar. How confident do you feel in your ability to effectively use interpreters to deliver educational content to refugees and immigrants? For example, Yusra and I are both bedside nurses who did not receive training on effectively using interpreters prior to starting our jobs. We quickly noticed issues that have come up while using interpreters. These include cultural miscommunication and lack of comprehension of the educational content that we were teaching our patients.
And in addition to the bedside experience that I have, I also had a personal experience with an interpreter during an appointment for my grandmother, where she was receiving diabetes education. The provider spoke to the interpreter instead of directly engaging with my grandmother. Since the interpreter used a different Arabic dialect, my grandmother struggled to understand the information, and the provider never checked if she fully grasped the content, which left me needing to advocate for her. Unfortunately, not everyone has someone who can advocate for them, nor do they understand the native language. Some definitions that we would like to review are interpreter versus translator. Here are some definitions that would be helpful. An interpreter is a person who translates spoken or signed messages from one language to another. A translator is a person who converts written text from one language into an equivalent written text in another language. And sometimes these two words are used interchangeably, when in reality, these are two different roles.
And there are two types of interpreting, and these are also important to know while as people who are using interpreters. Simultaneous interpreting involves the interpreter conveying the original message after the speaker pauses. This is usually used in conversational settings and is the most commonly used. The next one is consecutive interpreting, and this entails the interpreter translating the original message in real time while the speaker continues. This is usually used when one speaker is addressing a group, such as in conferences, and this does require specialized training and is not used as often as simultaneous interpreting. Now we'll go over the three different modes of interpretation. Each mode of interpretation, including phone, remote or video, and in person, plays a crucial role in educating refugees and immigrants. Phone interpretation offers flexibility and accessibility, allowing for quick connections when face-to-face meetings are not possible. Remote or video interpretation enhances engagement by allowing visual cues and fostering a more personal connection, which can be especially important in educational settings. In-person interpretation provides the most direct interaction, enabling nuanced communication and building trust between the educator, the interpreter, and the learners. Each method has its strengths and can be effectively utilized based on the specific needs and the circumstances of the individuals involved.
And it is important for an educator or staff who utilize interpreters to know the roles of the interpreter for an effective communication encounter. There are three different roles of the interpreter: conduit, cultural broker, and clarifier. Conduit is the most common role of an interpreter, where they accurately convey spoken messages from one language to another without any additions, omissions, or edits. This role is crucial for preventing misunderstandings between parties and is the standard function of an interpreter. Cultural broker. In this capacity, the interpreter provides the cultural context necessary for understanding the message. They help navigate cultural differences to facilitate effective communication. An example of an interpreter acting as a cultural broker for a Middle Eastern refugee could occur during a medical appointment. If the healthcare provider asks about the patient's recovery timeline and the refugee responds with inshallah, which translates to God willing, the interpreter might recognize that this phrase carries cultural significance beyond a simple time frame. In this case, the interpreter would explain to the healthcare provider that inshallah reflects the patient's belief in fate and the role of divine will in life events. The interpreter might add that this response suggests the patient may feel uncertain about the future rather than providing a definite answer. By clarifying this cultural nuance, the interpreter helps ensure that the healthcare provider understands the patient's perspective, fostering better communication and care. Clarifier. This role involves explaining concepts or using visual aids for terms that don't have direct equivalents in other languages. Clarifiers are vital for ensuring comprehension and verifying that the message has been accurately interpreted.
So we'll now be going over the interpreter use guide that is evidence-based and was created by the U.S. Department of Health and Human Services, Office of Minority Health. And they offer this evidence-based guide as an effective use of interpreters, and it outlines the best practices for 3 key stages. These stages include before the visit, during the visit, and near the end of the visit.
So before the visit, there will be a pre-session that includes an introduction, session goals, and guidelines, communication signals, and technical preparation. So for the pre-session briefing, you would hold a short meeting between the educator and interpreter to prepare for the session away from the client. Introductions ensure the educator and interpreter introduce themselves to each other and to the learners, clarifying the interpreter's roles and confirming mutual understanding. Session goals and guidelines. You would review the session's objectives, discuss potential communication challenges, and outline sensitive topics. Provide any necessary documents such as forms or glossaries for reference here. Communication signals. Establish hand gestures for pausing, seeking clarification, or indicating misunderstanding, and allow the interpreter time to voice any linguistic or cultural concerns. And for technical preparation, this is just to ensure a reliable internet connection if using digital services for the session.
During the visit, we'll be going over the introduction, using first person, using direct nonverbal communication, using clear and simple language, using sentence by sentence, the interpreter's role, and observation before interruption. For introduction, you want to introduce yourself and have others do the same directly to the patient. This establishes rapport and clarifies your role as the leader of this interaction. You want to use first person between yourself and the interpreter, and you both need to use first person language to maintain clarity in this communication. For direct communication, always face and speak directly to the patient or the client if they are looking at the interpreter. Maintain eye contact with the patient. For example, you want to use appropriate positioning like the triadic interview style that is essential for facilitating clear and direct communication in a non-intrusive way. The interpreter serves as a neutral third party, ensuring they can see and hear both the client and the educator, while also allowing both parties to hear the interpreter effectively. For nonverbal communication, you want to be mindful of both yours and the patient's body language and other nonverbal cues. You want to speak clearly and use a calm and clear tone of voice. Avoid shouting or speaking too loudly. Use simple language and avoid using complex or medical jargon that may confuse the patient or the learner. You want to speak sentence by sentence, meaning you want to speak in short, clear sentences to allow accurate interpretation without losing information. And then lastly, you want to understand the interpreter's role. Allow the interpreter to ask questions to clarify meaning, but monitor for appropriate use of their role as well.
And these are some things that you would want to consider for near the end of the visit. The teach back method. After providing information or instruction, ask the refugee or immigrant to repeat the information in their own words. This helps confirm that they understood correctly. For example, you might say, "Can you tell me how you will navigate the supermarket?" rather than, "Do you understand?" Also, rephrase as needed. If the patient is unable to explain accurately, rephrase the information or instructions and ask them to try again. This ensures that misunderstandings are identified and corrected immediately. And for the interpreter's role, you want to ensure that the interpreter understands the purpose of the teach back method and uses first person language to facilitate this process. The interpreter should translate exactly what the patient says without altering it. You would also want to allow time for questions. After confirming understanding, give the patient time to ask any questions or express concerns. This provides an opportunity to address any confusion and reinforces their role in their own care. Clarifications. Encourage the individual to ask for clarification if something is not clear. You want to emphasize that it is okay to ask questions and ensure that they feel comfortable.
And here are some final tips and takeaways. Direct communication is key. Always speak to the learner directly, not the interpreter. Use first person language and maintain eye contact to establish rapport and ensure clear communication. Pre-session preparation is essential. Conduct a pre-session briefing to align on goals, discuss potential challenges, and establish communication signals such as hand raising. This ensures the session runs smoothly and addresses all relevant topics. Clarify and confirm understanding. Use the teach-back method to verify that the learner comprehends your instructions. Encourage them to ask questions and provide clarifications as needed. Respect cultural contexts. Be aware of cultural nuances and use the interpreter as a cultural broker when necessary. Understanding cultural references helps prevent miscommunication and fosters trust. Monitor and adapt. Observe that interaction dynamics. Step in only if necessary to keep the communication on track. Ensure the interpreter remains a neutral facilitator without overstepping their role. And lastly, use simple language in short sentences. Avoid jargon and complex terms. Speak clearly. Use sentence by sentence interpretation to prevent information loss. Here are our references that we used in order to complete this webinar.
And this is our short post survey, and there is a QR code or a link. And we would appreciate if you took the time to fill out the survey. And if you have any questions, please feel free to contact us via email.